Imelda Redmond is the National Director of Healthwatch England, which is the champion of health and social care users. They're an independent arm's-length body of government. She's on the government's social care sector COVID-19 support task force. Good afternoon.
Good afternoon.
Can you understand why people are angry about the Prime Minister's comments?
I do understand people's anger about this issue, and actually I think that the issues that underlie all of this have been there for a very long time. There has been underinvestment in social care for very many years, and there needs to be quite significant amount of reform, and it's been talked about for many years and hasn't been acted on, and actually all those fault lines have been laid bare during this pandemic.
There has been a suggestion by some that actually this is seen as a sort of positioning ahead of any inquiry as to where blame may lie. Is that how you see it?
I don't know whether I see it as part of where blame lies, but I do think that we need to understand and learn lessons as quickly as we can before we enter winter, so that we can be ready to deal with the issues. The care sector is a very complex sector, and I don't think that we had a real handle on the when the pandemic planning was happening, on the complexities of that sector. We know more now, but we really need to get to grips with it before we enter winter and perhaps a second wave.
So in answer to the question of why there were so many deaths in the care sector, what would your answer be?
Well, what Healthwatch hear from families all over the country all the time, the sorts of things that they're talking to us about is the fact that care homes were instructed to stand ready to receive people from hospitals. If you remember, there was great pressure to get people out of hospitals so that we would have capacity to deal with people who were very ill. But those people coming out of hospitals were not always tested, or were not tested in the early days. So that's part of the problem. The other issues around, we heard a lot from families about the lack of appropriate PPE, protective equipment, that care homes and to be frank, the social care sector in general had to get access to the right type of care. And it was also, it is such a complex environment with so many people. Nobody had a handle on the total sector. The data's very poor. There isn't a way of contacting all social care at the same time. Some people pay for their own, some are paid for through local authority. That complexity was not understood.
OK, well, we're in a situation now where we're having to deal with this virus for months, possibly years, and it'll be those in care homes who obviously are most vulnerable given their age. Is there a sufficient grip, and I'm asking you because you're on the task force, is there a sufficient grip on it now?
Well, I think under the leadership of David Pearson and senior people at the Department of Health and Social Care, there is a better grip on it now than there was. So there is
Sufficient?
Really, we won't know until David's task force we've only been around for about 3 weeks. There is a greater grip on it. So there is a senior nurse leading on testing and tracing. We're beginning to see more data come through. So it's a better grip than we had. But the underlying problems are that we didn't plan properly, and we really need to get that into place now.
Imelda Redmond, thank you very much.